Hi, I'm Dr. Shruti Thar, practicing gynecologist in Mumbai. Today, we're gonna talk about something that affects most of the women, that is fibroids. If you have severe pain or severe bleeding or know somebody who's suffering from fibroids, then this video is for you. So what are fibroids? Fibroids are nothing but an overgrowth in your uterus. They are non-cancerous, that is, they never turn into cancer. However, they may cause a lot of other set of problems. Depending on the size of the fibroid, which may vary from a small pea size millimeters to centimeters, they have varying symptoms. It may lead to excessive bleeding during periods, excessive pain during periods, excessive pain in your abdomen throughout the month, constipation, frequent urinary tract infection, also infertility. Now, depending on the location of the fibroids, most of the symptoms may or may not be there. Why do we have fibroids? Well, first is genetic or hereditary. That means if your mother or nanny or your sister has it, there are higher chances that you may also have fibroids in the future. Hormones. The same hormones that are responsible for your periods every month, that is estrogen and progesterone, are the one which may cause fibroids. So if you are obese, if you are very young at your first periods, then or you have any condition which leads to unopposed estrogen, you are at a higher risk of developing fibroids. How do we diagnose it? Well, when you go to your gynaec, she will examine you, a pelvic examination, and if she is suspicious of fibroids, she may ask you to undergo ultrasonography. USG most of the times will pick up the fibroid size and the location. However, MRI is the gold standard just before the surgery so that we can landmark your fibroids so that it becomes easier for the operating surgeon. So what are the treatment of fibroids? Well, if they are small and does not cause any symptoms, doctor may just ask you to observe and do annual or 6-monthly checkup. However, if it has started affecting you or the symptoms have increased, there are certain medical management that can be asked. However, the efficacy of medical treatment is controversial. Surgery is the gold standard. Now, minimal access or laparoscopic myomectomy, that is removal of fibroids, or if you are above 45 years of age, removal of uterus, that is hysterectomy, is the standard protocol. However, there are certain newer modalities like uterine artery embolization and MRI guided focus ultrasound therapy. Their efficaciness is still debatable. However, they could be an option for patients who are unfit for surgery or are still waiting for the surgical time. So this is a short overview of fibroids. Most of the time I get asked is, can we do something to prevent it? Now let me answer. Ideally, there is no certain things that you did or did not do to get fibroids. However, lifestyle modification, regular exercise, meditation, clean eating, no smoking, minimal alcohol intake obviously will help. I hope this answers all your queries regarding fibroids. But if you still have any questions, please free to let us know in the comments. I'll be happy to help. Bye.